Hi, and welcome to another episode of A Closer Look. I'm Steve Boyce, your guest host, and today I'm with Ellen Flaherty. Ellen is the director of the Dartmouth Centers for Health and Aging. Welcome. Thank you so much for coming in.
Thank you so much for having me, Steve.
Ellen, today I'm hoping we're going to talk mostly about the Dartmouth-Hitchcock Aging Resource Center, but I know that's part of the larger Dartmouth Centers for Health and Aging. Tell us a little bit about what the Dartmouth-Hitchcock Aging Resource Center is and how it fits into the larger organization.
Sure. So the Dartmouth Centers for Health and Aging is an umbrella for three centers, one of them being the Dartmouth-Hitchcock Aging Resource Center. The other two are the Northern New England Geriatric Education Center and the Dartmouth Center for Aging Research. The Aging Resource Center is funded by Dartmouth-Hitchcock to provide support and services for older adults around many different issues, and the services are provided free of charge.
Fantastic.
And again, supported by Dartmouth-Hitchcock and also by some philanthropic funds from gift accounts.
Fantastic. I was browsing through the current Aging Resource Center catalog, and there are just so many opportunities and programs and offerings in here. We can't possibly talk about all of them, but perhaps tell us a little bit about some of the most popular programs.
Sure. So we have ongoing programs that have classes twice a week. So for example, exercise programs, gentle yoga, Tai Chi Quan, Moving for Better Balance. So those classes are very popular and folks participate more than once a week. Then there's other classes that happen quarterly or twice a year that are very popular. So for example, the Geisel School of Medicine students run a cooking class, which is very popular and fills up pretty quickly. We also have programs that focus on designing your own funeral. That is kind of a one and done. So we'll run that maybe once a year, and those programs fill up pretty quickly. We also have an ongoing program focused on tech coaching. So we have students from Lebanon and Hanover High School who come every Wednesday afternoon to the center, and folks can make an appointment and be coached around any of their devices, whether it's their phone or their iPad, and that's pretty popular as well.
So if I have pop-ups appearing out of nowhere on my laptop, or I'm not sure how to download the latest app, I just come in during those times, or do I make an appointment?
So it's best to call ahead and make an appointment to be sure that we have the coaches there, but people are certainly welcome to drop in, and we have people dropping into the center all the time. It's actually a lovely place with a beautiful living room and a library, so people can come in and have a cup of coffee and browse the library, or stop in if they wanted to talk to a tech coach on Wednesday afternoons.
Fantastic. Now, how do folks in our viewer audience actually get this brochure and be able to see all these programs?
Sure. So the brochures are actually distributed in paper form pretty widely throughout the Upper Valley, but can also be accessed through our website, which is dhaging.org, and they can download the catalog, which comes out twice a year. So this catalog is covering the spring, and then we will have another catalog that comes out around the first week of September to register for classes.
Some of the things that were interesting to me in the program, I know for myself, as I'm starting to accumulate decades worth of things in the house, this concept of downsizing and hoarding. I saw a number of things around that in the program. Could you tell us a little bit about that?
Sure. So we actually run some programs on decluttering. There's another program that I actually run on how to stay in your own home, and that focuses a little bit on that kind of downsizing, decluttering. But we actually have a program that focuses on supporting people who have a hoarding disorder. Which is a lot more common than people think. And there is an evidence-based intervention. It's a 12-week program that people participate in to really help them around this issue, and that has become a lot more popular, and we have a lot of asks of our faculty experts to go and promote that in other areas as well.
Wow, so opportunities around everything from the natural downsizing process all the way to serious hoarding
Right.
Episodes. Another theme that I saw in the program was around balance and falls prevention. Tell us a little bit about the importance of that and what types of offerings are in here for
Sure.
our viewers.
So falls are a major issue as people age, and can often be the precipitating event that causes them to not be able to stay in their homes anymore and sustain serious injury. So we have, in part, we have a federal grant focusing on building capacity for evidence-based falls prevention programs. So two of those programs that we actually run through the center, one is Matter of Balance, and that focuses on decreasing people's fear of falling, which is actually something that increases somebody's risk. And the other program is Tai Chi Quan, Moving for Better Balance, which is, again, a Center for Disease Control evidence-based program. We have Donna Pigeon, who is one of 5 master trainers in the country, is at the center. And one thing that we do is we try to work really closely with primary care at Hitchcock and other places to have folks identify people who are at risk and then to refer them to the center. And what we try to do is we try to get people in to participate in what we call a balance day. So these are walk-in sessions where people come in, they're tested, so there's some physical testing. We ask them some questions about their risk, and then we talk to them about what programs are available in their area, and really coach them to reduce their risk.
Wow, so there are real opportunities not only around the educational piece, but actually improving an individual's own balanced performance.
Yeah, absolutely.
Excellent.
Yeah.
I noticed also a number of very specific helpful programs in terms of very specific issues that someone might have. Foot problems, vision problems, problems with sleeping, seem to really cover a whole bunch of those areas.
We're really fortunate, Steve, that because we're so close to Dartmouth-Hitchcock and so close to the college, that we have a lot of professors, a lot of people who are faculty, who are physicians, nurses across the street that volunteer their time to come and give these lectures, whether it be on sleeping issues or, as you mentioned, foot problems. We actually have a group of people that come to help folks think about hearing aids. So what kind of devices are out there, and really steer people in the right direction for very specific issues like that. We've run some programs for veterans on what benefits they can tap into.
Great. I know another thing that's close to home for me is the concept of advanced planning. And I know that recently I got the Vermont paperwork and gave it to a loved one and suggested, she had actually asked and suggested that maybe this is a good time to start filling that out. And frankly, she was overwhelmed, and it's been a number of months now, and she's saying, you need to come here and help me. I see that you offer that kind of help.
We do, and I think many people seek counsel, go to their attorneys to help them do that, which is perfectly fine. But we coach people a lot around advance directives, and we like to think about that in terms of what matters most in your life. So having those conversations and then being able to document that for them, and being able to provide that documentation as well for their providers, or to get that into the Dartmouth-Hitchcock system. We focus on not only what matters most, but really trying to incorporate the concepts of what we call an age-friendly health system, which is actually an initiative that's being funded by the John A. Hartford Foundation and the Institute for Healthcare Improvement. So really helping health systems to think about things that matter most for older adults.
And on a really kind of fun note for me, something that brought back some memories. Some of my fondest memories of my grandparents on both sides happened in the kitchen. And I saw something in here about the grandparent-grandchild's cooking class.
Yeah, so that's a really cool program that we recently just started, that we have a cooking class with grandparents and their children, and that actually happens at the co-op right next to our office in Centera. We also have another program that focuses on what we call grand friends. So it's older adults and toddlers that we have collaborated with the Upper Valley Music School. So bringing together generations, not only through our tech coaching, but through some of these activities has been terrific.
Wow, so they're coming together and singing or playing instruments and things.
Instruments and and singing.
Wow,
and
fantastic. Now, I think you mentioned it early on, but let me just check in again because there's just so many incredibly valuable programs here. How does this, did you say there's no cost to any of our viewers that would like to call and start participating in these programs?
We have been able to provide our classes free of charge, which has been wonderful, and certainly that has happened because of the support of Dartmouth-Hitchcock, which is really terrific, and also through donations. So people will donate to the center, and that really enables us to be able to provide all these programs to people who likely could not afford to participate in them.
Now, if someone in our viewer audience, after having seen this program, is inclined to want to donate, what should they do?
The best way to do it would be to go to dhaging.org, which is our website, and they can donate right online.
Great.
Yeah.
Great. Now, so many classes. I think I also picked up that there's a main location, but then there are some other locations. Where are these? Where are all these programs taking place?
So the main location is in Centera Parkway, which is right across from the hospital, right near where the Co-op food store, Margarita's restaurant, and the courthouse, and that is in the Evergreen building, and that's our main location. And again, because of the generosity of some folks in Dartmouth-Hitchcock, we were able to secure space for an annex, and that is at the Lebanon Senior Center. So that's a separate location attached to the Lebanon Senior Center right near the Green in Lebanon that enables us to hold classes there, which helps people who can't necessarily get to the main center. There is bus transportation directly to the annex location. The bus directions for the Centera location is that folks take the blue line to the hospital. That's advanced transit, and then they take the hospital shuttle over to our site. And all this information is also included in the brochure. So if people go to the brochure, they can figure out how to get there.
So for anybody that doesn't have easy, direct access to transportation, by going to your brochure, there are options for them to have transportation provided one way or another.
Absolutely. And through advanced transit, and I'm not sure that many people know this, that people can actually get door-to-door transportation through paratransit. So that's a process where people apply for that, but people who have some disability and couldn't maybe even get to a bus stop can actually get door-to-door transportation, which is really wonderful.
Fantastic.
And that's all free of charge.
Now, you mentioned an annex at a senior center, so you're partnering with the senior center or more. What is the difference between the Aging Resource Center and what they provide versus what our viewers might already be taking advantage of at these local senior centers?
Right. So many senior centers provide not only a meal every day, but they provide a mechanism and a way for people to socialize. And they do run some programming as well. Our center, we provide more support, programming, education, exercise classes, but is not necessarily a meal program.
Now, how many people take advantage of these programs? How busy are you?
Last year, we had about 60 programs, and we had about a little over 700 individual sessions. that over 4,000 people participated in.
Wow.
Yeah. So it has grown. The centers have grown, which is wonderful. And we're able to offer more classes, which is great, especially now that we have the annex.
Yeah. And I think you might have touched on this when you were speaking just a bit ago, but do folks need to register for these classes in advance, or are these
Most of the
drop-in?
classes people register for, and that happens very often when our new catalog comes out.
Okay.
But not all of our programs are full, so people should go online or certainly pick up the phone and call us. Again, always best to register for a program before
Okay.
they come. But we're always happy to see people walk in and just kind of want to look around and see what we have to offer.
Yeah.
And that's great too.
But it can be as easy as a phone call. What phone number would our viewers
The
call?
phone number is on the brochure.
Okay. Tell me another very interesting program in the brochure is the Memory Cafe. What is the Memory Cafe all about?
So the Memory Cafe is a program that's run one Saturday a month at the Howe Library in Hanover. And the focus of that is to bring together people who have some dementia and their caregivers, their partners, to focus on activities that somebody with memory issues can actually participate in. So there's all kinds of activities, there's music, there's dancing, there's a very structured program. The program is terrific in that we work really closely with the Dartmouth undergrad students. One of the sororities actually sends, upwards of 10 students for each Memory Cafe to really participate. And that is something that has been repeatedly said, how much people enjoy having the students engaged in that. A big part of what we do with the centers, which I haven't talked about, is our work with people who have memory issues. And that starts out with people who are in very early stages of Alzheimer's. So we actually have a support group for people in the early stages of dementia, and really work with the patients and their families as they kind of go through this journey. So we have not only structured programs, like I mentioned about the support group, but caregiver classes, caregiver support groups, and we have one-on-one counseling by our dementia resource specialist, and we're also really fortunate to have a chaplain. So we have a geriatric chaplain that really guides and directs our spiritual program. And I think one thing that we like to reiterate is that this is a non-denominational chaplain, somebody who provides, again, support to people in crises, regardless of whether they are part of an organized faith or not. So helping them through crises, helping them through our support groups. So we have bereavement support groups, caregiver support groups. And as the population ages, and we think of this demographic imperative that as the population ages, especially in Vermont and New Hampshire, more and more people, unfortunately, will be diagnosed with dementia. So that seems to be a big demand and is only going to get greater in the future.
So everything from activities and programs to groups, support groups, to individual one-on-one consultations, call, go online, get the brochure, see what's available.
Call up and make an appointment with one of our dementia resource specialists. As you can well imagine, when that diagnosis is made, it's really, really hard. It's really hard for patients and families to know what's the next step. So we also work closely with primary care providers, not only at Dartmouth-Hitchcock, but in our area, to provide them with this resource that they can refer people. As you know, primary care offices are usually pretty busy places, but we're happy to jump in and provide that support and communicate back and forth with the providers.
And now, not just for older adults, but their caregivers. So a young fellow like myself would be seen coming into your library and coming in for consultative services.
Absolutely. We get a lot of calls from children, and not necessarily children locally as well. We have a number of videos that are on our website that really focus on what happens when the diagnosis is made and what are some of the things that you should start to think about, like advance directives. Maybe you should see an attorney. And then as the disease progresses, we talk about things like driving and how does that change, and end-of-life issues. So even if a caregiver or a child is not local, we have some resources we can direct them to.
Fantastic. I learned looking through your catalog that art and viewing art actually uses a different part of the brain than that might be affected by certain types of dementia. So I see a lot of art, programs, things to do with art, art to view, activities, maybe even a big art show of some sort. Tell us about all the different art programs going on.
So we have a lot of programs that focus on art. Again, back to providing support and programs that people can do regardless of their memory issues. We also have 2 art shows a year. We focus on older adults in the Upper Valley who are artists, and we run 1 show in collaboration with the Ava Gallery. We also have a program that was originally started by Dr. Bob Santulli, who's a geriatric psychiatrist, that focuses on bringing patients with cognitive impairment to a gallery. And as we all know, art is the interpretation or the experience of art is very different. There's no right or wrong interpretation. So it really provides an opportunity for people who, again, have some memory issues or cognitive impairment to enjoy a piece of art and to talk about it in whatever, frame that they're in.
Very nice. You house the Parkinson Center there, as I understand. What is that all about?
So the Parkinson's and Movement Disorder Center is located within our center. So that, again, is a Dartmouth-Hitchcock initiative that actually is a collaboration between the Department of Neurology and the Aging Resource Center. And that center, again, provides education and support to individuals with Parkinson's and movement disorder. They hold many public conferences that are actually pretty popular. And that also can be accessed through either our website or their website, which is Dartmouth-Hitchcock /Parkinsons.org. And so there's some conferences coming up, and they bring in lead researchers and again, focus on not only education, but what are some of the things that folks can be doing? What's the latest and greatest research?
Yeah. Are there volunteer opportunities?
There
with the
are,
organization?
absolutely. Thanks for asking, Steve. So we have volunteers. We have some volunteers that are very, very committed to helping and sit at the front desk. And then we have some volunteers actually that are professionals. And actually we have a volunteer who helps us to do some training around with medical assistants. So Dartmouth-Hitchcock has a medical assistant training program. And we like to say that we geriatricize the medical assistants by providing some really specific content around geriatrics. So, for example, sensitivity training, literally where the students, wear rubber gloves with rice inside and glasses with Vaseline, and we put them in wheelchairs. And so we have a volunteer who's a nurse. And so she works with the medical assistants, which is really terrific. Fantastic.
So this is obviously a very unique program and set of programs that you offer. What else? What might I have not covered or asked about that I think would be really important to bring out?
Yeah. So I think that there are some people that have, again, are extremely comfortable with coming to the centers for a variety of, again, all the programs that I mentioned. So we like to think of ourselves as kind of a home where people can come. People travel long distances to come to Dartmouth-Hitchcock. So it also provides an opportunity for people to, again, come into the living room, relax if they have time between appointments, or they're traveling at a distance and they come early, that they're always welcome to come to the centers. I think one really unique thing that I touched on a little bit is how the centers, again, the Centers for Health and Aging, not only has a connection with the college, so we have a lot of researchers. We bring in about $6 million in grants to study everything from muscle weakness in older adults to loneliness and depression and Meals on Wheels recipients. So we have researchers literally sitting there in offices, and then we have an education center where we're actually providing education not only to older adults but to professionals, and we do that across the country. And then we have older adults coming to the center. So that's pretty rare. There's only a handful of centers for aging in the country that actually have older adults walking past researchers and educators. So that's terrific.
So this is an amazing opportunity then for any of our viewers or anybody to come in and take advantage of the Aging Resource Center, but also then to be right there in the same environment and collaborate with the educators, the researchers, and I know you have an extensive library there as well.
Yes, and we have so many people, participants, that are so generous with their time in terms of helping us with some of our research. So we have older adults who are willing to participate in focus groups, for example, on specific websites. And we do a lot of work with technology and handheld devices. So willing to come in and participate and help us test those devices. So again, having people come into the center and understand all that goes on is really a wonderful experience, I think, for the researchers as much as it is for the participants.
Fantastic. So before we wrap up, I think we'll have your phone number up on the screen for our viewers. Tell us one more time the website they should go to.
Right.
We'll have that on the screen as well.
So the website is dhaging.org. And when they go into the site, it talks a little bit about the centers, but then there is a place for folks to click on programs, and then they can pull up all the classes that we have and search. And of course, any questions at all, just pick up the phone and call us.
Wow. Well, Ellen, thank you. On behalf of everybody here at CATV and all of our viewers, thanks to you and to all of your staff and to Dartmouth-Hitchcock for the amazing resources that you provide.
Great.
We hope to have you back again in the future.
Thank you, Steve.
And thank you for joining us for another episode of A Closer Look.